Tihe mauri ora, ko Michael Egan toko papa, no tarawhiti ia. Ko Kathy Egan toko mama, no otutahi ia. Ko Richard Egan aho, no te whanganui atara aho. Ka no o otapoti ai nei. Tēnei te mihi kia koutou katoa, mauri ora kia tātou katoa, tēnā koutou, tēnā koutou, tēnā koutou katoa. So in the language of the Indigenous people of New Zealand, I say where I'm from, my mother and my father in New Zealand, and that I now live in Dunedin. And I'd like to acknowledge the tangata whenua, or the people of the land, of this place. I'd like to acknowledge this place where we are here. People who have recently died, and there have been people I know in this audience that's happened to. And I'd like to particularly thank Catherine and Hazel who've made, and their team have made it really easy to come to this place. And it's been a great experience so far. I tell you what, it's hard to be the last person though over 5 days, let alone watching the rugby. Though we did get into the semi-finals, there was another team who didn't get... Okay, so what I'm calling this is spirituality and ageing from across the ditch, and some New Zealand perspectives and really my perspectives, and a bit of a call to action. I'm going to say a little bit about who I am, because I think that's important when you're talking about spirituality. I'm going to start and end with a song as long as I've got time, and then I'm going to suggest a bit of a framework for understanding spirituality, and then talk about this call to action idea. The first thing is about who I am, and that quote from Schneider's I think is a good one. So essentially I come from, as I say, born in Wellington in New Zealand. I've got a Catholic background to the degree that I spent a couple of years in the seminary, studied theology, eventually left and did a degree in English and religious studies, so was very interested across the religious spectrum. That book, Healing Our History, was a really important book for me. It's a story about Pākehā and Māori New Zealanders coming together and understanding our history in a treaty context, which is very important for New Zealanders. I became, after 5 years of secondary school teaching, I became a health promoter. That's in a public health unit, and I was a mental health promoter, and the Ottawa Charter is key to that down the left-hand side there. That's the team I work with at the Social and Behavioural Research Unit. That's the University of Otago and Otago. That's my son up there, Benji, who's just turned 11, and on the right of that is not a photo of my wife. She didn't want a photo of herself. But she's a full-time artist, and that's one of her paintings. And the way that I keep my soul singing is through surfing. So down the bottom there is me surfing, believe it or not. So New Zealand, you know where we are, just that other island off the edge of Australia. There's almost 5 million people. We're trying to get there. There's about 16 or 17% Māori, 70% European, 9% Asian, and 7% Pacific. Our life expectancy is about 79 years for men and 83 for women. That inequality is not examined very much, actually. But the big inequality that we do look at is that Māori men die 7 years on average before I will. And I'll talk a little bit more about that inequality later. We've got about 3% unemployment, which we crow about, apparently, but I think there's a lot more to it than that. Our big things are tourism, as you probably know, agriculture, wine. We're secular, but there's much more to it than that. And I come from a Charles Taylor point of view on secularity, we can talk about later perhaps. And much of what I'm going to talk about today is focused on what I call the 88%. And the 88% are the people who don't attend church, temple or synagogue. So this is not about you, probably. This is not about the people who are spiritually literate, who are religiously literate, who are spiritually intelligent. This is thinking about the people who aren't. We have many spiritualities, multi-faith approaches, Māori, Pacific, Pākehā spiritualities. We have a very strong bicultural approach and a multicultural approach. Our spirituality is rooted in the land and in nature, and if you've been over there, you'll see that connects with many of us. And like you, there is a fair go approach, though that has been undermined, I think, by inequalities. But it's not all good. We have a lot of issues, particularly around domestic violence and suicide. Unfortunately, we have one of the highest suicide rates in the world. And Julia Liebrick, who was the first mental health commissioner, she says there's an agonising emptiness within our society that I think reflects a desperate need for meaning, relevance, something deeper in life. And that comes from her talk, which was published, called Making Space, Spirituality and Mental Health. So even in a land of relative plenty, we still have a lot of issues, and I think spirituality is key to those issues. In terms of our population, we have, as was discussed in this conference earlier in the week, we have that bulge. And in fact, this comes from New Zealand Statistics Department. They suggest that it's not a bulge, that it's the new normal, that our ageing population is going to double, and by 2056, 25% of the population of New Zealand will be 65 years and older. So I think this is both an opportunity and a challenge, and I'd like to talk a bit more about that too. Secondly, in terms of demographics, for the first time, the no religion category in the census, and this is a 2018 census data, exceeded the Christian religion category. And this I think, and it's been happening over consecutive census. Now, there's a lot to be said about no religion. I don't believe no religion people have no belief and no sense of who they are and what they're about. But it is a very interesting thing. And I think that's part and parcel of what I'm talking about today, is the forgotten 88%, if you like. So, I'd like to suggest a couple of basic propositions of which I'll then try to consider a bit further. Oh, wrong way. First, I think we're in a state of ontological fragility, and that's at a population level. I certainly wouldn't want to comment on your personal spirituality. I imagine, like you think about it all the time and have the odd existential crisis, but you're quite, as I said, spiritually literate. But I think at a population level, there's quite a lot of frailty, and there's a bit of evidence for that. That is, and Lloyd Gearing suggested this in New Zealand, probably our greatest known theologian, that New Zealand's in a post-Christian world. Worldviews are often unexamined and fragile, challenged particularly at the end of life. A structure and system for meaning and purpose and beliefs is lacking. Where I am from, where I am going, why do I exist, how can I contribute? These things are lacking in our general discourse. And perhaps there's an argument that this is also leads to the growth of mental illness, suicide, and other challenges. Where previously we had salvation in the Christian context, enlightenment, satori, and other religious things, we'd no longer have the structured way of learning, particularly as we grow up and as we age and as we die. Secondly, I'd like to suggest that spirituality is important, and I'm sure you'd agree with that. But actually, from an evidence-based position, I'd like to show that there's ample evidence to suggest a positive relationship, and I'm talking epidemiologically here, between spiritual well-being and other health outcomes. And while this is nominally accepted in our institutions, it is often token, othered, or grudgingly accepted. And some people have called this a paradigm war going on, which I might talk about later too. Thirdly, I think we need to increase spiritual literacy, from upstream governments and policy to bedside with patients, family and whānau. Fourthly, I think we need to increase or develop a spiritual lens or analysis, what John Swinton calls seeing the world differently, from mainstream cultures that marginalise spirituality because it doesn't fit into the scientific materialistic worldview, what John calls the empirical worldview. I'll return to this particularly regarding indigenous and alternative ontologies, the way we see the world, and hold spirituality as a primary focus. The spiritual analysis or lens, I believe, is missing from much of our political and economic discourse, including in our challenges of lifestyle issues such as smoking, alcohol, drug and other drug abuse, physical activity, etc. In fact, there's an older person's conference going on last week in New Zealand, and there's a lot of talk about obesity and smoking and drug abuse amongst the older people, but in none of the discussion was spirituality a component in the causal pathway. Also, issues such as community disconnection, and then the big wicked problems. In public health, we call the wicked problems with no theological background, actually. They don't understand that at all. But they talk about the wicked problems of inequalities, climate change, and racism. And then finally, I think we can grow our spiritual intelligence and wisdom across the lifespan in new formal and informal ways, but particularly with our elders who have so much to give and have been silenced in much of contemporary Western culture. And I think we have in New Zealand a particular example through Māori and Pacific that I'd like to talk a bit more about, and that's that final point. Okay. So I'd now like to go contemporary and have a minute and 20 seconds of a song, please. So, the Black Eyed Peas, thank you. Where is the love? I think there's a whole lot of things going on in this song. 2 weeks ago, my 11-year-old said, "Dad, you got to listen to the song." It was on the radio. And I had heard it, but I hadn't really listened to the lyrics. And I listened to it over and over again and thought I'd like to bring it to this conference. It asks a whole lot of questions that I think are big public health questions related to spirituality and spirituality in ageing. It says we live like we have no mama, so we're disconnected. It talks about addiction, and I think addiction is a major issue today. It talks about discrimination and racism and madness and depression. It talks about possible ways to address that through love, respect. If you know the truth, if you never know truth, you'll never know love. It talks about controlling your mind or understanding your mind through meditation. And it talks about Father, Father, help us, send some guidance from above, because people got me questioning, where is the love? And whatever you believe in terms of theism and your understanding or your image of God, I think as a metaphor, I think that's a really interesting thing to be calling for outside of ourselves, asking for help. Thank you. That's I think the contemporary position, and I think drawing from those sort of contemporary positions is really useful, and I continue to do so. So what I'd like to now do is suggest this framework to explore that ontological fragility. And the first component of it is definitions. And it's kind of that first thing that people say, what are you talking about when you're talking about spirituality? And I often use the consensus, Christina Puchalski et al.'s consensus definition. I was actually in Geneva when we argued for 3 days about this definition. And she flew me there. It was remarkable. She must have got lots of American money. But if you look at it, it's dynamic, it's intrinsic, so it's part of us and it changes. It's about seeking ultimate meaning, purpose, and transcendence. That word has come up a lot. Experience through relationship, through self, family, others, community, nature, society. That sort of reminds me of Liz's definitions and models. And expressed through beliefs, values, traditions, and practices. In New Zealand, we put together what I called a map of the terrain rather than a definition. Because I think, as I've suggested here, is that everybody has their own definitions of spirituality and experiences it differently. But it includes some commonalities. Commonalities like we have around our sexuality. Spirituality has some commonalities, including ultimate beliefs and values, a sense of meaning and purpose, connectedness. So it's not that dissimilar to the Consensus Project. You'll probably know there's over 70 published definitions of spirituality, but there are some of these commonalities. Unfortunately, John's gone, because I said I was going to quote him, and this is one of my favourite papers of his, John Swinton and Patterson. And he says, in fact, the vagueness of the concept is one of its strengths. Its lack of clarity around the term is actually a strength that has powerful political, social, and clinical implications. He goes on to say, he talks about and names a series of absences. The areas, absences, and quests that have real and appropriate effects on society, institution, and individuals. And these sites are resistance of void and absences in healthcare. And I'll come back to that because I think that's a really important reflection that John made. So secondly, if you think about, okay, what is it? It includes those things. Secondly, where does it fit in our models of care and healthcare, but our models or understanding of the world? You might say our ontologies. In New Zealand, the dominant way of understanding health or well-being, or what we call ho order, is expressed through this model called Te Whare Tapawhā. And Professor Sir Mason Jury, probably our best-known Māori professor, who's a psychiatrist and a professor of public health, in 1985 suggested the Tapawhā model. It's now taught in all state schools in New Zealand since 2000, and all of our medical students and nursing students and other healthcare professionals learn this as the model for health. Now, you may say, oh, it's an interesting model. It's like many, many other models. But what was radical is it changed the state of looking at health in our healthcare education, pre-service at least, from thinking of the biomedical model to include psychosocial and spiritual domains. So it's quite a radical thing. It's taking time to embed. We also talk about the Fauna Farley model. So this comes from Carl, who is based on the Samoan model. So there's many, many Pacific nations and there's many Pacific models, but this is the best known of the Pacific models of health in New Zealand. And Samoans are actually the largest Pacific population in New Zealand too. In fact, bigger than Samoa in Auckland. But I think this is an important model because it adds something also to the Tapawhā model. Thirdly, comes from the Cancer Society of New Zealand. This is a little bit like your cancer councils. So we have a cancer society. And when they look at supportive care in New Zealand, partly because of some work that we did with them, they consciously consider the 4 domains. Next, the Hospice Model, and you'll know this comes from Cicely Saunders, 1968. She named total pain. She said people don't just die physically. As you know, they die physically, socially, mentally, and spiritually. And hospices all around the country and in New Zealand have adopted this model and consciously and explicitly try to address the 4 domains. Our PhD did a national study of this, a mixed methods national study of this, and we found they weren't doing it very well. So what we suggested is that they needed to up their game. For example, they relied on Christian charity to have spiritual carers in their hospices. So we argued successfully that all hospices should have paid chaplains, for example. We also argued that people didn't really know what spirituality was in the hospice staff, and that they needed a professional development program, and that we then became part and parcel of the development and then later evaluation of a professional development program from the cleaner to the CEO and all the staff in between, and that's been a very successful program as well. Secondly, lastly, comes from the Netherlands, one of the most secular countries in Europe, and they I pushed the wrong one. And in the Netherlands, they have this in their oncology within their cancer world. And what's fascinating about this is that they have spirituality in the centre with the other domains around it. And now I've spoken to Mason Jury about spirituality quite a lot over the years, and he says, actually, this is the way Māori look at health and well-being as well. And I'll talk a little bit about that later as well. So, in summary, in thinking about principles and models, we've come from, and perhaps still are in many cases if you look at the budgets of hospitals and many other places, focused on the biomedical, what I call the bioreductionist approach. But there is a continuum or a pendulum swing towards the biopsychosocial spiritual, say holistic model. And this is expressed in things like Tapawhā, and that rather than paradigm war happening, there is a bit of a cross-paradigm dialogue happening between these things. Now, I teach every single medical student that goes through our medical school, and the medical students are actually starting to ask me about spirituality before I even start talking about it. So I think young medical students are starting to pick up on this, and certainly the nursing students are as well. So I have some hope for that changing. The third component of this framework to understand it is the evidence. And as you'll know, if you work in a hospital or have anything to do with medicine, we are in a very strong evidence-based culture. Now, there are lots of issues around evidence-based medicine. It's really about drug trials. So for everything else, there are some questions. But we still need to be very clearly within what I call an evidence-informed approach. So just this week, I've done an analysis of the publications on spirituality, religion, and aging. And what you can see here is that there's been this massive growth of peer-reviewed publications in journals around the world in this area. And this particularly happens from about 2000, and this is the case for all areas of spirituality and health generally. I think Lindsay Carey's done most of those, probably. Kia ora, Lindsay. So there really is a growth in the evidence base around spirituality and ageing. Other people, and I'd like to acknowledge Elizabeth McKinley, who's been talking about this for a long time with her books and her publications, and there's a journal for religion, spirituality and ageing. And this comes from Blavatsky, who said, interest in spirituality and ageing has increased recently, primarily because of the empirical researchers overwhelmingly demonstrate the health benefits of spirituality and religious participation. And I've got David Bowie there, because David Bowie said, ageing is an extraordinary process where you become the person you always should have been. And I really like that, and as you know, David Bowie talks a lot about spirituality. Then we've done some studies over in New Zealand. So this was the PhD work that we did, the National Hospice Cancer Care Study. I do a lot of work in supportive care and cancer, and almost every study has a component of spirituality. And I guess you could say, if I was to generalise about those studies, it's acknowledged but not known how to operationalise. We've done some work in oncology wards, that's in Dunedin, Southland. We've done a couple of studies with spirituality and medical education. To our surprise in this study, the professors, so we interviewed all the sort of senior professors, who were mostly old men, who said, actually, to our surprise, they said spirituality is important. I'm not quite sure what it is or how we operationalise it, but they did say it was important. And it's given us some evidence, actually, in relation to that, it's given us enough evidence to now do a spirituality class in the second-year medical students, to all second-year medical students. And after 150 years, this is the first time that's happened. And while it's only 1 hour, it's quite a significant conceptual change for that medical school. We've done quite a lot of work in age residential care, renal, spirituality and dementia with Chris Perkins, a psychiatrist who has done a lot of work over there, a little bit of work in the armed forces and spirituality, the professional development project that was related to the hospice that I mentioned before. I've worked across the world a little bit with looking at spirituality and how it's expressed in different countries. We've done quite a lot. We did a big national study of spirituality and nursing. This was not dissimilar to the medical study, actually. Again, nurses learn a lot about spirituality in their pre-training, but they often get into hospitals and there's no time, or there's no supportive environment where spirituality can be nurtured. And I could talk about that a lot. We worked with the Salvation Army and we evaluated their bridge program. This is a great story. The Salvation Army gave the University of Otago Psychology Department a whole lot of money to evaluate the bridge program, which comes from the bridge program funding comes from the government, but it had never been evaluated. It's the biggest A&D, alcohol and drug program in New Zealand, and it's in Australia as well. Anyway, the psychology department designed this really well, thought through evaluation. The Salvation Army said, we'd like the spirituality component evaluated. And the psychology department said, well, what's that? We're not quite sure what that is. So they had to come and see me. It was a great moment and say, well, they want us to think about spirituality. And so, okay, we've got a good instrument and we'll put some open-ended questions. And actually, once we had finished this, and it was a very rigorous study, the spiritual component, and I don't mean religious, I mean spiritual broadly, the spiritual component was the most important component in the recovery for people going through the bridge program. And we've done a couple of co-design projects. I work with a chaplain in central North Island in spirituality and elder care and cancer care. And then I've got this ongoing project on spirituality and public health, a new area. Oh, and then, how can I forget this? I'm writing about it at the moment. We're doing an Oranga 2 project. Oranga 2 means a healthy stand in Māori, which is sort of a play on words when you hear what this is about. It's about Māori prostate cancer. And we've been interviewing Māori men across the country. Oh, that's right. And then euthanasia, which is going to possibly happen in New Zealand, and mental health promotion and palliative care education. This comes from one of our best GPs in New Zealand. The spiritual life is the cheapest, most accessible, and most effective medicine we have after warm houses, good food, and clean hands. When we truly connect to an individual, the intimacy is rewarding of itself. But if we're lucky, we can also be for a moment a glimpse of the interconnectedness of all things beyond this, a sense that we are part of a larger whole. This is a healing intuition and a powerful succor for individual loss. And Glenn Calhoun he's a poet as well, and he's been writing and thinking about this for a long time. I really recommend any of his writing if you get a chance. So, if you think about the evidence is starting to inform policy. On the left there is the National Health Service document. This is available online for free in Scotland. It's called Spirituality Matters. It's for all healthcare professionals in Scotland because of the evidence. That Foundations of Spiritual Care, that's that professional development program I talked about. Also talked about the national guidelines here. And in fact, I think you're leading us by miles in terms of your guidelines, policy, and resources, both for at the aged care, but also the quality spiritual care guidelines that just came out last week. I recommend them. I do highlight this quote down below. Our Ministry of Health is slowly catching up, and even though this was in 2010, it still remains very aspirational that all staff working in cancer treatment services have a basic understanding of the spiritual needs of people with cancer. So that's what I'm working towards. And evidence informs policy, and policy gives practice teeth. So I think we need to use the evidence and the policy to say, look, this is important for these reasons, and we need to inform our healthcare professionals how to feel comfortable with this and how to work with the patients that they serve. There's some other evidence that's happening through our healthy ageing strategy, where they say that spirituality should be a component of both the assessment and how it's going to be addressed. So I've talked about the scope, the principles, and the evidence-informed component. The people who are leading this is a DHB, or a District Health Board in central North Island, where they've got a transforming spiritual care strategy for the whole of the DHB. Their mandate is to ensure spirituality becomes an integral part of healthcare at the mid-central DHB. So that's sort of the direction that I'm trying to get happen across the country. Oh, I put this here as well. They've got a community development strategy, so this is just for the area. And remarkably, they framed it within Te Whare Tapawhā, that Māori model, right down to inclusion of spiritual well-being as outcomes for the community. So it really is starting to filter through. So finally, the zeitgeist. And the zeitgeist is a lovely term, a lovely German term, meaning the spirit of the times. And the spirit of the times, I think, is quite important in this context of spirituality, in both in ageing and in society generally. Because my grandparents, they wouldn't have asked the question, what does spirituality mean, and what's its relationship with religion? It was just a given. But I think what's happened in that kind of postmodern world where everything's been challenged, in a globalized world where everything's been relativized, that's part of the zeitgeist or the spirit of the times. And I'd just like to say a couple of things about that. Firstly, like many Western countries, we have very low attendance. As I suggested, probably about 12%. It varies between demographics. So in older demographics, we have more people attending church, synagogue or mosque, and in different ethnicities. So in Pacific Island cultures, probably about 60% of Pacific peoples in New Zealand go to church. It's about 95% in the islands. But we do have this growth of the nuns, and we have this very growing, and this is around the world, this spiritual but not religious group. We have, within health and within our own Dine, what I call the long Dine syndrome. Most of us will die of heart disease or cancer, 60% of us in the Western world. And what that means is that we will die over a long period of time. And that's a lot of 3 a.m. moments. It's a lot of existential, spiritual moments where you've got time to think about what is it all about, Alfie? And who's going to look after those people who are asking those questions? And in New Zealand, largely it's not religious ministers. So what I say to the doctor audiences I speak to fairly regularly is that you are the new priests, and they completely freak out. because actually it's the doctors and the nurses and the OTs, etc., who people are going to be asking about these questions, particularly at 3 a.m. in the morning. Then, as I said, this is part of New Zealand, the multiculturalism, the pluralism, and what you might call the democratisation of spirituality. The other thing is and this comes in line with what Lloyd Gearin says, what fills the post-Christian vacuum, the spiritual vacuum? John, I remember, he wrote a book called Long, White and Cloudy in Search of Kiwi Spirituality. And in that book, he said that we need to be careful that the spiritual vacuum isn't filled with a Coca-Cola story. And what he was getting at is that the worst of American culture, and I lived for 7 years in America, so it's not all bad, but what he was getting at is the worst of American culture, individualism, over-reliance on materialism, over-hedonism, if you like, that fills that gap. But there's an alternative reading of this also, is there a re-emergence of new spiritualities that might fill that gap as well? And then you can't talk about spirituality in New Zealand without talking about the contribution from Māori. It's given us points of entry to talk about it. It's given us not only points of entry, but an actual, because of the treaty, which I'll mention later, that we need to talk about it. And Mason Jury says this, that taha wairua, which is spirituality, is generally felt by Māori to be the most essential requirement for health. So imagine if we took that seriously. And then lastly, I think this is important, the evidence around this in New Zealand is a little bit slim, but there's more of coming around the world, that there's the so-called dispirited health workforce. Somase, I always get I'm not sure if that's the right, Daniel Somase, he's an ex-Jesuit PhD ethics professor, not from Yale, but something like that, and he suggests that there's a spiritual crisis amongst American healthcare professionals, because the meaning and purpose that they went into that profession is no longer there. You know, it's all about technology and litigation now. So I think that's part and parcel, that the healthcare professional spiritual well-being is very important. Okay, so I've talked about who am I, I've started with a song, I've talked about this framework to understand spirituality, and this is what I teach nurses and doctors, so they can come away with some way to frame, understand spirituality if they're asked about it. So now I'd just like to say a couple of things about transformation, or what we might be able to do about this. Oh, and there were my propositions. Okay, the first thing. So Jury also said, without a spiritual awareness and a modi, the modi is the spirit or the vitality or the life force, which as we heard from the Oxford textbook, it literally comes from the etymology of the word spirit. An individual cannot be healthy, says Jury. From a very good paper that I just found when I was preparing this talk, and I got very excited. Valentine is a Māori psychologist, and she did a PhD, and she wrote this paper, and she said spirituality is inextricably linked in ways of being for many Indigenous people. I recommend the paper. She also said that there were key themes in her analysis, and she was looking at the relationship between spirituality and psychology, an unexamined area, I think. She says wairua, or spirituality, is fundamental. It knows no boundaries. It's a perceived sensation, and it's relational. That was in fact that was her PhD themes. Sarah Wood, who came from Canada actually, and she spent time at our biggest Māori urban NGO or non-government organisation, and she did this lit review on spirituality, Māori and ageing. And kaumātua are older Māori people, saying kaumātua are generally highly valued by Māori for their roles in preserving and passing down traditional knowledge. And this, I think, is the important part. Nurturing younger generations and their formal and informal leadership roles in their whānau's family and wider connections. And I think this is part of what we need to learn. The treaty, which we have finally got around to recognising and expressing as important in New Zealand, has a fourth article. It was an oral article, and it suggested that it was about the protection of Māori custom and the position of wairuatanga, spiritual well-being and spirituality, of te reo Māori language and tikanga Māori of culture. So I think we're more and more talking about needing to recognise and I guess believe that the treaty is true and that there's a bicultural relationship where the tangata whenua, or the people of the land of Māori in New Zealand, have a primary status. And we've undermined that in many ways. 53% of our jails are filled with Māori. Remember, there's 16% of the population. The inequalities are literally a sin. Some people said inequality is the greatest sin in public health, and I think that's true. The other thing I think we can learn from is our Pacific peoples. As I said, Samoans in Auckland, there's more Samoans in Auckland than there are in Samoa. And in this very good study, and I know Charles Watergrave, some of you might know him, an Anglican priest, says New Zealand mainstream culture view of self as individuated stands in contrast to the Pacific views of self as a total being who exists in relationship. And I think that's, we've talked a little bit about over the time, the last few days around this as well. Now, I think that our culture, and I'm talking about the non-Māori, non-Pacific culture, has this in its background. And we've been overwhelmed by the neoliberal Coca-Cola story and have forgotten our connectedness to each other. But I think that Māori and Pacific are reminding us about that. The study went on to say, and I'll just read this last bit, it is this accumulated wisdom and maturity achieved by elders that is respected by younger members and their communities. And I'll just read the last one. Spirituality is not just an element of age or the aging process. It is not equivalent to such elements as housing, electricity and power, information and transport. Viewed from this perspective, and this is the important bit, spirituality is the key constituent force in the whole life process. So this is 8% of our population, this is 17% of our population, Māori and Pacific, who we are beginning to learn from in New Zealand. And there's a line that we often use in health that what works well for Māori will work well for the rest of us. And I think that we're starting to learn that in this area as well. Sir Paul Callaghan was one of our greatest scientists. And so I've suggested that it's important for Māori, for Pacific, and actually I think it's important for non-Māori and non-Pacific, because while he said he doesn't believe in the 3-0 God, ditto, but he does say that that doesn't mean I'm not a spiritual man. So what I'm talking about here is not the religious spirituality, and I think we need to qualify spirituality with adjectives or adverbs, so religious spirituality. But for this man, there was a spirituality that was very important to him, and he died of cancer, and I think this is an important component. So Bruce, many of you will know Bruce Rumbold, and I think this is getting into the public health argument. He said, yes, this is important spirituality, and it's important in the revival of within ageing. However, the benefits will be of limited value if we do not attend to the settings in which spirituality is to be lived. And what we argue in public health and health promotion is that the environment in which people live, work, play, and in some cases worship is equally important as being educated at the individual and family level. So you can't be spiritually well if you live in a spiritually ill environment. And that's what that image is about. So, and I met this man, Trevor Hancock, this year actually at a conference. He asked this great question, and this was in 1985, and it's still as relevant today. Why do we structure our society in such a way as to create ill health? And is there a way to structure our society as to create health that includes spirituality? When you hear the word health, well-being, what we call hauora, we need to think at least physical, mental, social, and spiritual. So spirituality is a public health issue. We consciously, and this comes from the legislation, we think about improving, promoting, and protecting health and well-being. So where does spirituality fit into that approach? We have a model called the Untitled Chapter, and it's one of the Bibles of health promotion. And I think that there's a way that we can do that we can create spiritually conducive communities and environments by using the Untitled Chapter. And just in case I forget to say this, I think we need to ally with people like public health and health promotion people to do this. I think it's in policy, but we need to name it. I think we can create supportive environments. Fran Baum, an Australian from Flinders, says to realise full potential, I think we need to include all the dimensions of health and well-being. I think we need to think about our communities, and when we do a needs analysis with communities, at the moment we ask them a whole lot of physical health issues and often an economic analysis, but how often do we do a spiritual needs analysis of a community? I've looked at the literature and I can't find any. Personal skills, so that's the health education component of it. So that works, I think, right across the life course. And then, of course, reorientating the health services so that reminding our health care professional friends that actually holistic approaches are important. So I think that ageing is a spiritual experience, and how we contribute to an environment where we can, and how can we contribute to an environment where spirituality can flourish as we age, I think is a really important question. So I've been doing the spirituality and public health study for about 2 years, actually. It's one of those studies that just keeps going on and on without getting published, but it's getting closer. And I've been interviewing people all around the world, mostly in Ireland, England, Scotland, who you might know someone, the States, and Australia and New Zealand. And one of the questions or the things that we developed in the study was this idea of the spiritual analysis. And how can spirituality impact on the world? And one of the participants said, with spirituality, we say meaning and purpose is significant. So you shift your angle a little bit, nothing really changes, but you suddenly see everything differently. That's all we're trying to get our politicians to think about. The same person said, how alive forces of love are in a society, that spirituality asks that question. And this is part of the spiritual lens or the spiritual analysis that we want people to think about. The first spirituality conference I went to in Australia, Elizabeth McKinley said, and I quote, there's more questions than answers in the area of spirituality, and that's how it should be. And I love that quote, and I always say it. But that's what we're asking here of our politicians, of our policymakers, of our communities, of our families, organisations, is to think about those questions. I also think this is a development I've been reading a little bit about. Steve Bucco and Fox wrote a book called The Spiritual Revolution, and they talk about the contemplative revolution. And I think this is a really interesting one. If you don't work on yourself, then much of your politics is merely projections. We have to do the inner work that allows the outer work to be authentic and also effective. I mean, this is not new to you, but I think we all do need a spiritual practice, whether we're religious or not. You know, I try to have a daily spiritual practice, and I've got lots of priest friends. I always say to them, you know, your job is to be a holy man, not to be an administrator. So I hope you're doing lots of spiritual work. I put this in. So this man used to be the advisor to Obama on the environment. He's no longer at the moment. But I think that's a very interesting point that he makes, because basically climate change is the emergency in the world. We have islands in the Pacific that literally won't be there in 20 or 30 years. But what this man, who's a scientist, says, that it's not the scientists, the science and the statistics and the evidence that's going to make the difference, that it's a cultural and spiritual transformation that we need. Now, he's not talking about religious communities here, he's talking about society. And then, of course, our fantastic Prime Minister, Jacinda Ardern, she has brought the language of spirituality, though she doesn't call it that, into politics. She talks about kindness and love and compassion. And she does that at the UN World Assembly. We have a wellbeing budget, and in the wellbeing indicators, they have spiritual health. They're not quite sure how they're going to measure it yet. I've been writing to the Treasury for years, and I think that's why they've done this. But it's also it's not because of Māori as well. But I think this is a significant shift. We had a terrible tragedy in New Zealand on March the 15th. 51 people died because of an act of terrorism by a white man. And I'd like to acknowledge past and ongoing terrorism events. But what was most fascinating, what was most, I guess, heartfelt about this event was the response. And all cultures and all faiths came together emotional. And it was led by Māori, and it combined and worked with faiths. And I'd just like to show a week after the Christchurch event, they had an event in Hagley Park, which is the biggest park. They got tens of thousands of people, and this happened all across the country. But at that event, they played the song, and I'd just like to play that now, please. So I started off with a song that was saying, "Where is the love?" That kind of challenged, "Where is the hope?" and named a whole lot of problems. And I think that out of that March 15 event, that there was a huge amount of hope as expressed. These are two of the sort of young, cool singers in New Zealand singing a song that is inherently religious, but stands as a metaphor for something that is more spiritual, about bringing people together, about trying to make meaning and try to understand a horrible event. So it was a very significant event, and I think, naturally people have, to some degree forgotten about that, but I try to keep it at the forefront. Jacinda Ardern has something called the Christchurch Call that she's been working around the world with, about trying to do something around the internet and such terrorist events. Anyway, I think that's an important component and something that's happening in New Zealand. I've got a whole lot of things here, but what I'd like to do is I'll just put them up and you can read them if you like, but there's only a couple of more minutes, so if there's any questions that people or comments that people are dying to make, I'd love to hear them. Kia ora and thank you.